Hi there, my name is Carlo Renato, chiropractor and PhD candidate in vestibular rehabilitation. As manual therapists, whether we're chiropractors, osteos, physiotherapists, we've all seen the benefit of treatment to the cervical spine and reducing symptoms of dizziness. And these can include blurred vision, poor balance, as well as unsteadiness. But how do you explain this to patients? How do you explain that working on the neck can improve your vision, can improve your balance, can improve your unsteadiness, can improve your pain? How do you explain this to allied or medical professionals? Do you use an outdated model of bone pressure on the nerve, or perhaps you use energy flow and you're helping that work better? Perhaps it's time that we embrace contemporary research in this field and use it to explain many of the comorbidities and symptoms that we commonly see. We also use that research to help explain our proposed care as well as our expectations. This research has been championed by physiotherapists from University of Queensland, namely Julia Treleaven and Gwendolyn Jull and team. They've shown repeatedly that a dysfunctional cervical spine, as caused from a whiplash, can cause disturbances in information that go from the neck to these sensory motor centers in the brain. And these include areas that integrate information from our vestibular centers, our oculomotor centers, our balance centers, as well as pain centers. So it's not surprising that when someone has a dodgy neck, that they have many of these symptoms. And I've just included here one of the many references that we cite in our upcoming seminar, and we'll discuss this amongst others. So Treleaven and co. have shown in many studies the neurophysiological underpinnings that we see in practice, and importantly, some of the fantastic assessment tools that we can use in clinic to identify and quantitate the cervical joint dysfunction. And I'm sure no matter which profession you're at, we certainly need more measures of this. In our upcoming seminar, we help translate some of this great work from research into usable and reliable applications with the cervical spine patients. One of the most popular tools that we use is this head-mounted laser system and target charts, and you can see the targets right there. Here we identify cervical joint dysfunction as measured by the joint position error test developed by Julie Treleaven, and it's a measure of proprioception. Following that, once we've got an identification of the amount of deviation from normal, we can then use these charts, which we've developed, as part of our rehabilitation. So we both have the assessment and rehab. So at our upcoming seminar, Advanced Protocols for the Dizziness Patient, we go through the neurophysiology of cervicogenic dizziness. We do many practicals on the sensory motor, neuromotor, oculomotor, and balance tests to properly evaluate the cervical spine and discuss evidence-based guidelines on rehabilitating it. We're presenting in Melbourne, August 5-6, Sydney 19-20, and Perth, September 16 and 17. Limited tickets are available, and they're available at www.brainhubacademia.com.au. We certainly look forward to sharing this information with you at this time. And until then, thank you. Bye-bye.